My name is Diamond Hills, and I'm going to be performing an assessment of the heart, the neck vessels, and the peripheral vascular system. I'm going to start off by making sure that the patient is laying at a 30 degrees angle, and I'm going to check for visible pulsation, which I see, and then I'm going to palpate the pulsations of the apical impulse. And I'm going to use the palmar surface of my hand in the apical area, and once I found the pulse, I'm going to use 2 fingers to palpate the apex. Okay, and then I'm going to go to the left sternum border, and then I'm going to go to the base of the heart, and I'm checking for any abnormal pulsations, and I don't feel any abnormal pulsations or vibrations, which is good. So now I'm going to auscultate over the apex to listen to the apical impulse. And I'm going to be listening for heart rate and rhythm using the diaphragm of my stethoscope. Okay, then I'm going to auscultate the aortic arch. Then I'm going to go to the pulmonic area for S2. Then I'm going to go to the Erb's point for murmurs. And then I'm going to go to the tricuspid area. And then the mitral area for S1. Okay, and S1 would be the lub of the cardiac cycle, and S2 would be the dub of the cardiac cycle. And S3 and 4 would be the extra heart sounds, and that's what I'm going to be checking for now. So can you turn on your left side for me? Okay. Okay, everything sounds good. And you can turn back on your back for me. And when I checked for the S3 and 4, the extra heart sounds, I used the bell of my stethoscope to listen for that. And I didn't hear any abnormal sounds, which is good. And that completes my assessment of the heart, and I'm going to move to assessing the neck vessels. Okay, I'm going to firstly make sure that the patient is laying supine and that the torso is elevated to 30 degrees, which it is. And I'm going to start by observing the jugular vein. Okay, and I'm going to observe it at 45 degrees. So can you sit up a little bit for me? Then I'm going to observe it at 60 degrees. And then at 90 degrees. Okay, and it looks fine. You can lay back at 30 degrees for me. And at each angle, I looked for distension of the jugular vein, making sure that it is not distended, bulging, or protruding at 45 degrees and higher. So next, I'm going to auscultate the carotid artery using the bell of my stethoscope. Okay, sounds good. And then I'm going to ask for you to turn your head away from me, please. And hold your breath. Okay. Now I'm going to ask for you to turn your head towards me. Hold your breath again. Okay. Now I'm going to palpate the carotid artery. You can turn your head away from me again. Okay, turn it towards me. Okay, everything feels normal. So now I'm going to move on to assessing the arms, hands, and fingers.